Good evening, ladies and gentlemen who have joined us on this Dr. Fundi channel. My name is Dr. Fundi Lenyati. I'm the host of this channel. Today, I've got a special guest, Dr. Prudence Buthelezi. I'll just give you a brief about Dr. Buthelezi. She is a qualified medical doctor who obtained her undergraduate MD-CHP degree from Sefako Makgato Health Sciences University in Pretoria. She originally comes from Soshas, which is Soshanguve, here in Gauteng. And she's here today as my guest for us to just focus on the issue of the rising number of healthcare professionals that are losing their lives in the line of duty. She is here not in her personal capacity, but she is here as the General Secretary of the National Healthcare Professional Association. This is a relatively young voluntary association that represents all healthcare professionals, irrespective of the healthcare discipline. Now, welcome to the Dr. Fundi channel, Dr. Prudence Buthelezi.
Thank you so much, Dr. Nyati, and I'm very, very much pleased to be one of your guests in your studios.
Thank you very much. I appreciate you giving us time for this interview. I know that today you are on call, but you had to make a plan for you to be able to come and have some discussion with me relating to the issue of the rising number of the deaths amongst healthcare professionals for illnesses that are related to COVID-19 or complications of COVID-19. All right. Before I get to that issue, can you just tell me a little bit about the work that you do at this moment as a medical doctor?
Okay, as you've said it, I'm Dr. Buthelezi. I'm a GP running my private practice. I'm a sessional doctor at 2 hospitals in Mpumalanga. So I'm based in Mpumalanga as much as I grew up at Soshanguve, but I'm in Nelspruit. That's where I'm staying in Mpumalanga. And I'm also a senior MO at the oncology here at Rob Ferreira since we've started the oncology department.
Yes.
Yeah, and then I'm in SG, Secretary General of National Healthcare Professional Association, which is the association that we started in 2016 with the likes of Dr. Gumete, Dr. Lamula, and others.
Yes. All right. No, thank you very much, Doc. So, your organization, National Healthcare Professional Association, is just 4 years old, but it has taken up, quite a number of big fights, in recent times. Last year, if I'm not mistaken, or the year before, you guys, you actually raised the issue of racial profiling by medical schemes against Black and Indian doctors. Am I correct with that?
Yes, you are correct. I think even now, what has pushed us to make this video of the death, it shows that we didn't start this year to focus on the death of the healthcare professionals, because that was the main reason when we started the association. We saw many healthcare professionals who were dying, killing themselves, committing suicide when they were threatened by medical aids, stressed and depressed by medical aids. And when we followed what was exactly happening with the medical aids, we understand that no, this thing, it was only happening mostly in Blacks. Yeah. I think people who were following the Cartel of Med scheme, Section 59, which was shared by Advocate Mugai Tobi, they know and they understand what was happening exactly. And we are still waiting for the full report from the CMS up to this day. So the death of the colleagues is one of the things that it touches me so much. because I was even following the interns who are just interns when they die when they are post-call. Then I realized that the hours that they are working is too much for them. It's affecting them. When they are driving back at home, they die.
They
So
fall
those are
asleep
the things
behind
that,
the wheel.
yes.
Yes, yes. So, so the reason for this organization to be formed was really around the welfare and the interests of healthcare professionals across the board.
Yes. We realized that most of the associations, they are concentrating on one is either doctors or they are dentists. But we know when we are treating a patient, we are a multidisciplinary approach. Then we also had to come with that approach that we need, when we fight together. And also to understand when they talk about the orthodontist, what are they talking about? How do I refer patients? You know, that relationship within us. So we're making it even more stronger.
So, and more of fostering inclusivity, fostering the ability to work together and move away from the fragmented silo approach that we normally see in the healthcare, space.
Yes, the other thing that always pushed us to make sure that we work together, we unite, is that we were going out the provinces, making sure that we educate the healthcare practitioners, especially the GPs, that working in solo it's not gonna work when NHI comes. So we rather be united, work together, and have we know the other racial the whites. They do better when they are doing working like that. We know their practices. So we also decided that we as blacks, we must also try that, you know. But how do I refer to the occupational therapists if I don't understand how do they work exactly? So that's why NHCPA came with that unit of all different professions. Whether we are a physio, whether we are a dentist, whether we are a psychiatrist, we are all together.
Yes, and in the process get each discipline to have a bit of working understanding of what the other one does and at what point should one refer to them and vice versa.
Yes.
All right, and how have you done on that? Are you getting people joining the organization and being part of the membership?
Yes, we are now sitting at about 2,400 members, registered members with NHCPA. And our aim, in fact, was to have about 10,000. You know, when we have this bargaining chamber at the public sector, where we don't have a seat, and we understand that most of the association, they use Bonehau, Dinosa just to get one seat. And we found that the voice of the healthcare professionals is not heard enough because we are sending other people. We don't sit there ourselves. So hence, we still encourage people to join NHCPA in numbers until we have that share and be able to fight for the healthcare professionals in the public sector.
Yes. No, I think you guys are on the right track. Like I said, the few issues that you've picked up already, they have gained national prominence, especially the issue around racial profiling. Yes, we are still waiting for the final report from Advocate Mugai Toby, but I am certain that when that report does come, it is going to have to, it will force the various stakeholders to change their approach to how they deal with private healthcare professionals. So thank you about that. Now, this year, 2020, has seen your organization raising their voice around issues of health and safety of healthcare professionals, especially during this time of COVID. Can you just talk a little bit about that before we get to talk about the deaths?
Okay. We started early when COVID was starting, trying to engage both the minister and the president. But unfortunately, because as you said it, we are still a young association. I don't know whether we are too robust or what, and then the doors were closed for us.
Yeah.
As I speak to you, especially our Gauteng branch, they were even told not to consult directly with the Department of Health, but to via another association. We did write to the minister for that, and unfortunately, up to this day, we never get a response. We mentioned the issue of the PPE, very early stages. The main reason that was making me to write is because we have already received the complaints from the healthcare professionals that, doc, we are forced to see patients without PPE. When we want to complain, they've given us written warnings. They jump from, you know, there are levels that you need to follow when you are disciplining somebody. They were not followed. They just jump and giving them the written warnings. And I do have them.
So from no verbal warning, just straight to written warnings and maybe final warnings.
Yes.
Wow.
So we did write a letter to the minister that we as an employer, there's a law that is forcing you to make sure that those that you have employed, their safety, you know, the occupational and safety law.
Yes.
So we tried our best to reach to the minister as soon as it started, but we never get response. I remember even Nehau went to court, but they canceled that court case. I don't know what was the reason they canceled it, but they never responded to us when we were crying about the PPE until this is now happening.
Yes. Now you just mentioned now a few seconds ago the fact that all employers in South Africa have an obligation to provide a safe and healthy work environment for all their employees, and it even goes further, and any other stakeholders who make use of their premises, you know. So meaning, you know, if I'm a patient, I'm getting into hospital, I also need to be protected, you know. And if I'm a supplier supplying something to the hospital, I also need to be, you know, protected. But the primary responsibility for the employer is to make sure that its employees, and here employees is everybody employed by the employer, and it includes public sector and private sector. So when you say to me that you guys have been getting a cold response or no response from the employer relating to issues of health and safety, then obviously that just makes you to know that there's still a long road ahead. And so what has then happened since the time that you guys tried to engage with the Minister of Health?
As I've said it, that nothing has happened. Colleagues, they started to be infected, and others, they started to get very sick, while others, they died. Though I would like to highlight that the video is not only colleagues that they've died of COVID. There are those colleagues who just died right now. So the video is just so that we are saddened by the death of our passing of our colleagues. So hence we made a video. It's not all of them who've died of COVID, but yes, others, as you can, I think you've seen the City Press on Sunday, where it showed other colleagues who have died of COVID-19. Then we realized that no, we can no longer keep quiet and just write, may their soul rest in peace. What are we doing? Because tomorrow it will be me. And am I provided with enough PPE? Am I safe? I mean, when we say, Dr. frontliners, who are we talking about? People, they think maybe we are talking about the doctors, nurses only. It starts from the security at the gate. How many security have you seen them wearing the PPE? It starts with the people who are opening files, the clerks. Have we ever seen them wearing any PPE? The cleaners, they clean those rooms, they clean where we work. Have you ever seen them wearing PPE? What I would like is that I know when the minister and the president, they say they are coming to this hospital, they will make sure to cover up things. Maybe the next time, if the president and the minister they are coming to certain hospitals, they shouldn't mention anything so that they can see what is really happening.
So, I mean, even porters who have to move patients from one ward to the other, or to X-ray, or from ER to the ward, you know, they themselves are part of the broader healthcare workers.
Frontliners.
Yeah, the frontliners. Yeah.
Yes.
All right. So, but let's, as much as you said, the video is not everybody who died as a result of COVID-19, but a significant number of those people, you know, they have been reported to have died as a result of complications of COVID-19. So now let's focus on this past week here in Gauteng. We have seen reports in the media, you know, of about 6 or 7 doctors that actually passed in the past week relating to COVID-19, you know, complications. In fact, about 3 days ago, on your timeline, you also shared a video where a colleague had just passed on, and I think he or she was being taken out of ICU or high care, and there was a guard of honor by other healthcare professionals as you know, the body was being wheeled out, you know, to the mortuary.
That's true. Many colleagues, especially the one that you are mentioning in Gauteng, they've died due to COVID complications. And what is certain is that one of them, she died alone in ICU without resuscitation because they said we cannot resuscitate somebody with a COVID. When you know very well, her work was to resuscitate most of the time until people they wake up. So that one is very touching and it leaves us with a sore heart. The issue of PPE, Doc, it plays a major role.
Yes.
Some of the colleagues, they've told me that, Doc, we are being told to use a mask for 3 days, for 5 days. Some of the PPE are not enough. They don't have boots. Yes, they have a gown, but they don't have boots. They don't have a hair cover. Some, they are poor quality. I've seen those poor quality ones. They are so transparent that you can see what you are wearing and everything else. How sure are we? Because we know that there are billions that were given for buying PPE. But somebody who doesn't know anything about medicine, she's doing that business of selling PPE. How do they make sure that she buys the proper quality PPE? The other things, yes, others, we do have the PPE, but was there any teaching of the healthcare practitioners? How do we put it on? How do I put it off? Because sometimes you sit, you watch, the porter goes in that room that they call it the highly suspicious patient of COVID. She goes in there, she takes the file, to the next station. We are not taught correctly what are the steps. When you go to that room, you should go being dressed up. When you dress off and leave everything there, wash your hands, you know. The things that are happening, you can see that there was no teaching enough. Yes, COVID is new for all of us, but the teaching was not. It shouldn't be only us doctors who know how to dress, how to wash our hands. It also goes to the cleaners. It also goes to the porters, the teaching. Yes. So the dressing up and the taking off, I think also it affects us. Yes. Some of us wear glasses. I forgot I touch them, I take them off, you know, in that way.
So you're basically saying making the PPEs to be available is not everything, but also teaching the employees on how to use them appropriately so that they can offer the protection. It's also another very important part. Otherwise, then you have a lot of, I would say, human error that may actually result in that healthcare worker or healthcare professional infecting himself or herself.
That's so true, though, because that's what I've been noticing, that no, there's something wrong. We cannot cry because most of those others, they go to theater, they dress up, everything. Then you watch how to take them off. You realize that no, there's something wrong.
Yes.
Or not. So hence I'm saying the teaching, no one has came, only those maybe who work in theater, they know exactly how to dress up this whole thing. And then we are never told, we see on the internet that, okay, in a surface, it stays about 8 hours, in a metal, it stays about 24 hours, the virus. But we don't know how to protect ourselves further. Yes. I can dress up my PPE, but the next thing I forgot, I touch the files with the gloves. I take off the gloves, I touch the same file. Yes. Now with bare hands. I forgot, I take off my spectacles. In that way, I'm reinfecting myself. Yeah. So the teaching also, it's so important and vital for everyone.
And here I'm assuming in those facilities where the PPEs are available, because like you said, in some institutions, you have a situation where there's a shortage such that people have to use the same, PPEs over a period or not use them at all, because now they've got a life that they have to save, and they cannot just fold their hands and say, I'm not going to help because there's no PPEs. However, some organizations have actually said no PPEs, no work. What is your stance as the NHCPA as far as working in situations where there are no PPEs?
We say that the way there's no PPE, don't risk your life. There's no hurry in pandemic. Whether they've called you that the patient is in severe respiratory distress, you need to intubate that patient. But if you're not having your PPE, you rather stay back, because this is involving your life and your health, and also the kids at home or your family at home.
Yes. But then, Doc, don't you think other people might say that because a medical doctor signs the Hippocratic Oath, that they will do everything in their power to save lives? Won't then that stance of saying no PPEs and therefore, I won't do what I'm supposed to do, won't people say that that is encouraging people to actually abandon an oath that they took? I'm playing a devil's advocate here.
I can see. After the death of so many healthcare professionals, Doc, really, we took oath, but we are human beings too. Yes. If I die, oath won't raise my kids.
Yes. But somebody else will say...
So you have to put your life first.
Yes.
Prioritize your life first.
So that
then the oath will come. Because really, oath won't raise your kids, won't be there for your family. Some of us, that we have a black tax. They still need us at home. Yes. So if I die, who's going to take care of my father? Such things. Yeah. And what is it's irritating mostly, there were funds of PPE, but we don't know what happened exactly. Why the PPE, they don't reach where we need them in the hospitals. What is happening, we don't know. But we are expected to risk our life to save a life. Yes, I know. Most of us, it's hard. If I see somebody dying, I will go and help because of the heart that we have as healthcare professionals.
Yeah.
But we should know that we will die once.
Yes. But I mean, to also just come to, the same question that I asked you, obviously the risk of one getting infected in the course of doing your work, it's part of the occupational risk that we all have. Yes. However, reasonable steps still need to be taken, by the employer to mitigate that risk, and also you as the health worker to make sure that you use the equipment, appropriately. And if beyond that you get infected, then it's obviously something that one can't blame anyone. However, in a situation where there are no PPEs available, or the quality of the PPEs that have been made available are substandard, then one has a right to say, yes, I signed the oath. However, in this particular situation, the employer has not fulfilled its primary responsibilities. And as a result, they are putting me at risk. And so I am not keen to just go in and, and play Russian roulette, So now there is your organization, and there's also other organizations like NEHAU, that mainly represents, and DENOSA, that represents the nurses and other healthcare people. But there's also organizations like the South African Medical Association. Is there any collaboration, amongst yourselves, because you are playing within the same space, so that your voices to, the leaders in the healthcare, department, or Department of Health at national and provincial level, so that they can maybe listen to you? Is there any working together on common interests, even though you are separate organizations?
There is, because at the beginning of this COVID and the issue, when the healthcare professionals, they were telling me that they were getting written warning, I did consulted with the NEHAU in Gauteng, in Mpumalanga, in all the provinces. Then that's when they started to push the court case. And yeah, there is collaboration with other associations. And I think now, because of the increasing numbers of healthcare professionals, this will push us to unite more with other associations.
Yes.
We have no choice but to be united and to have one voice, because the more we are separated and we are belonging to NHCPA alone, I won't fight this battle as NHCPA alone. So I will need other associations to come and have a bigger voice that will be heard.
Yes. Now, earlier today, our National Minister of Health, Dr. Zwelini Mkhize, there was an announcement that was made that as a result of the increasing numbers of healthcare professionals that are actually dying as a result of COVID-19 related, complications, he has appointed my former, lecturer and professor, Professor Taule Mukwena. He's a general surgeon. When I was doing medicine in Natal many years ago, he's one of the surgeons that actually trained us, on various aspects of general surgery. So he has been tasked by the National Minister of Health to actually get to the root of why are the healthcare professionals dying in large numbers. And he has been given 14 days to revert to the national minister. on what are the issues. Now, I don't know, I did share that article with you earlier, or message with you earlier. As an organization, have you tried to find out more about that? Or because, it has just been announced today, it's still a matter that you guys are gonna, investigate?
Yes, and one of the other things that the minister has mentioned is that as much as you can see the video, it's only few, but I was really shocked when he said 187, in fact, of the healthcare professionals who were already passed away, and out of 12,400 who are infected.
Yeah.
I saw that one that gave a content prof to look at what is really happening. We just had this today, so we will sit down as an association to make means that we get to reach to him, because you won't find anything of value if you don't go to those who work on the ground.
Yes.
So, because in my association, including my leaders, as myself, I'm a leader, but I'm still working there and then. So that's where she can get more of the information if we can contact those who are on the ground. Yes. So we will make sure that we will also sit down and then we write to him so that we reach to him.
Yes. Well, I think that's an avenue that the minister has opened, so that somebody else independent of government can actually investigate. There's a lot of claims that have been made around, for example, poor quality PPEs, non-availability of PPEs, or like you said, people who have to use the same PPEs over a long period of time and exposing themselves to actually getting infected. So I think an organization like yours should proactively make contact with Professor Taule Mukwena, so that he's a very nice, approachable, prof. He never made us feel like students, and even now when you meet him, he's very approachable. So I'm sure if you guys make contact with him, he will give you, time, and he will listen to your concerns, because as many of the organizations that are in this space as possible should actually give input to him, so that the report that goes back to the minister is a report that is really representative of what's happening in the ground, with as many organizations as possible having given input into that report. So but now, Doc, just before the lockdown, the Unemployment Insurance Fund, UIF, they made an announcement that they were going to include any, normally when you get injured in the course of doing your work, you can claim for injury on duty. All right. And if somebody passes away, also there can be a payout, or if somebody gets to be disabled as a result of that, infection or injury, there's a payout. So the UIF has created a special benefit, a COVID-19 benefit for anybody who contracts COVID-19 in the course of doing their duty. And so that benefit is available for the person if they just, get to be disabled, or they've spent a lot of their money, but they did not succumb to the disease. But it's also available, I think, to the families of those who passed, should they lose their lives. So I think another organization that you guys need to engage with is the UIF, so that you can be able to create more awareness in your membership. Obviously no one wants to die, but in the event that somebody passes on, as a result of the work that they do, there is that new benefit that has been created since I think the middle of March by the UIF, which colleagues or the families of the colleagues that have passed can actually have access to. All of us, we have to take funeral policies and life policies, not because we want to die, but in the unlikely event that you die, you need to have that benefit. So even in the case of getting infected in the course of doing your duty as a healthcare worker, COVID-19 is now included as an occupation-acquired disease, which then means there can be a claim against the UIF in the unlikely event that somebody gets infected, spends time in hospital, gets disabled, or even loses their life. I thought it's something I needed to just share with you if maybe the association has not followed up on that.
Oh, thank you so much, Dr. Ngati. It's like just yesterday, the Free State group, we were still asking ourselves, people they are coming with forms from UIF for claiming of COVID, and we're asking ourselves, how will you prove that you really got it from the workplace, or you got it by the time when you went to the mall? So we're discussing among ourselves what we need to do as healthcare professionals. But thank you for giving us that information. Now we'll know the way forward, and I hope the healthcare professionals who are listening to this, they will also tell the families of those who have passed on already to also go to a UIF and claim, because most of the time, especially when you're a doctor or a physiotherapist, people they don't know those things,
Yes.
So
no,
I think that one is a good one.
Yes, I actually suggest that as the Secretary General of the organization,
Yes.
try and make contact directly with the compensation commissioner,
Okay.
under whom the UIF falls, because then you would be able to have clear procedures that need to be followed. But it's all about trying to say, I think I was exposed in this situation, and then the compensation commissioner, applies his or her mind on, the facts as written, on the claim, and then they make a decision. But it didn't sound like it's something that's very, very hectic to prove that. But I think the best way is for you guys to link up with the compensation commissioner. I can also give you a name of Dr. Nandipa Kasha. She's actually she's looking after Free State and also KZN, in the compensation, as part of the compensation commissioner office in those two provinces. So she can also be able to guide you guys on the processes that need to be followed, maybe even before you actually approach the compensation commissioner office. So after this interview, I will forward her particulars as well.
I would really appreciate it, Dr. Ngati. Thank you so much.
All right. As we go towards wrapping up this discussion, which is not a very comfortable discussion, because loss of lives, whether it is a family member or your colleague, it's really something that is not, it doesn't go down well. But as doctors, we sort of trained to deal with matters of life and death. But when it happens, to somebody that to a colleague, it really does touch you. And so I want to encourage you and your organization to actually step up your efforts and make sure that those rights that the doctors and the other healthcare professionals have in terms of ensuring that they are safe and healthy as they continue to do their work. The employers do their part because we have a shortage of healthcare workers in this country. So we can't afford to lose any more from something that is preventable. So I thought, I need to encourage you. I need to encourage you to collaborate with the other organizations, because the other day I looked at Summer, one of their newsletters, and it was just full of, people that have passed, that is colleagues, as a result of COVID-19 related deaths. So the list of people that are in your video is just a tip of the iceberg. Like you said, the minister said 187 people, have died in the healthcare space as a result of COVID-19. So those are big numbers in a country that has got a shortage of healthcare workers. So any more death is too much death, Yes. So as we try to wrap up, Doc, what other things would you like to share with our viewers who are largely healthcare workers?
Especially to the healthcare professionals, I know that we don't practice what we preach most of the time. We can tell our patient, take your vitamin C, take your medication, but only to find that us ourselves, we don't take our chronic medications, our diabetes, and we know that the diabetes, the hypertension, it puts you a high risk of morbidity when it comes to COVID. So I'll encourage my colleagues that if you have any chronic, take care of yourself. We've heard that obesity also plays a role. Let's try. It's not easy, but let's try. And another thing, as we say, your vitamin C, your vitamin D, let's try to take them, colleagues. And when you have already tested and you find that you are positive, don't nebulize yourself. Don't give yourself oxygen at home. Once it starts to get there, please just rush to the hospital. We have the WhatsApp groups. Just send your number and say that I'm not coping, guys, so that those who are close, they can call an ambulance to collect you. Please, colleagues, let's do what is right for ourselves.
Yes. Is there a WhatsApp number that you guys have as NHCPA, that doctors can use? And if you do have, you can actually share
yes,
it now.
The number that you can use is 076 1479 524, which is my number personally. So when you call me, I will call the colleagues in the leadership in different provinces to attend to you.
Yes. All right. Let me just repeat that number. It's 076 147 9524. Does your association have a website that people can also, use, if they want to report something relating to maybe a situation that is putting them at risk at the workplace?
Yes, there is a website. You can just even press Google and say NHCPA. What's happening now?
Yes, no, I'm listening to you.
Yes. Okay, I'm saying yes, there's a website. You can just go to Google and write NHCPA. It will put you straight to our website. We have a Facebook page. Also, just write NHCPA on Facebook. You will go to our page. And also now we have a Twitter.
Yes. No, thank you very much. You guys must modernize. They normally say medical professionals, especially doctors, are technophobic. But in this time of COVID, we have to embrace the technologies. Facebook is very important nowadays. Twitter is very important nowadays. We must embrace all these media, new and old media, to make sure that we are still able to keep in touch and be able to work together to try and solve the problems, but also deal with the issues not only affecting the healthcare professionals, but also issues that affect our patients. So, Doc, let me thank you for making time. I know I asked you at short notice, and I got your numbers from another colleague who is the Secretary for the Gauteng province, Dr. Nozugo Mkabai. So I am thankful to her as well for having given me, your contact details and for you having given me the time at short notice. I hope that with more of such interviews or conversations, the issue of the health and safety of healthcare professionals in healthcare facilities will receive the priority it deserves. Any parting shots, some words that you want to say before we close, Doc?
No.
You've said it all.
Yeah, I've said it all.
All right, ngiyabonga, KCC. Thank you very much. Thank you. And I hope that your call doesn't become very busy tonight. And certainly no lives should be lost tonight. So thank you very much. And also thank you to all the people who joined us for this discussion with Dr. Prudence Buthelezi from the National Healthcare Professional Association, a 4-year-old, broad-based healthcare professional association. Thank you to everybody who joined us. Till next time. Thank you.
Bye.